Hello, everyone. Welcome to sunny Tacoma. Anyway, what we are going to do is we're going to mix up the paperwork a little bit on you this quarter, or for Clinical 3 and Clinical 4. We've introduced two new pieces of paperwork. One of those is we're getting rid of the med cards. Yay! I'm sure all of you are quite happy about that. The med cards are too busy and they don't really relate back to your patient. So we're going to introduce a new med sheet, and I'm going to bring that med sheet up on the screen and show you what it looks like. And here it is. I'm going to zoom out because you see this little paragraph right here. I'm going to highlight this. That is the whole paragraph. The other stuff on this page is just 3 more copies of it. So you can put 4 medications on 1 sheet of paper. That's what that's all about. And I'll blow this up so that you can see it clearly. Basically, all that we are asking for your drug medication sheets relating to your patients in Clinical 3 is going to be the generic name and the brand name, and what drug family that belongs to. What drug class does that belong to? Is it a diuretic? Is it a beta blocker? Is it an opioid? Is it an NSAID? Yeah, every drug belongs to a family, and we want you to actually memorize those families more so than the drugs themselves. Also, the therapeutic dose. How much is normal for that? And that's easy to find. Any nursing drug reference guide will give that to you. Because one diuretic, the therapeutic dose may be 10 milligrams, 10 to 20 milligrams. A different diuretic, it may be 200 to 300 milligrams. So it's kind of important that you know that. A couple other things we want you to do. Action of the drug. What does it do? For example, and I'm going to go through one here just to give you a sample, and be more than happy to copy this one down when I get done with it. So what does that drug classification or family do? For example, a diuretic. What does a diuretic do? Well, a diuretic makes you pee off fluid. I wouldn't put it that way, but that's basically what it does. Also, we want to know, why is your patient taking it? This is important because there's a lot, I found in my clinicals that a lot of students would say, this is metoprolol, it's a beta blocker. Slows the heart down. Good, why is your patient taking it? I don't know. Now, you need to know what the drug does, and you need to know why your patient is taking it. Those are probably the 2 most important things you need to know when it comes to handing out medication. So we're going to have you put this on a little sheet, and do feel free to bring these sheets with you to the med cart when you start handing out drugs to your patient. We're not expecting you to memorize all this. We just want you to know it and know where to find the information when it's important. The last thing is any special precautions. Now, every drug out there has 114 different side effects. When they go to clinical trials and they give this drug to 80,000 people, everything everybody says, it gave me a slight headache. Well, they probably had a slight headache because they were dehydrated, but they still have to list it as a side effect. But there are certain things that certain drugs do that are pretty important. Let me give you an example. An opioid. Opioids are made from opium. They are things like morphine, oxycodone, hydrocodone. Any special precaution to that? Now, one thing I would look for if I was giving an opioid to somebody is, of course, sedation. You take too many oxycodones or you take too much morphine, guess what happens? You stop breathing. That's a bad thing. So that's one thing that I would put under special precautions because it's unique to that drug. You're not going to pass out if you have too much aspirin, but you will if you have too much morphine. Another thing that opioids do is cause constipation. So two things I would put down there was I would put sedation and constipation. Now, we're not looking for the 50 side effects that are listed in the nursing guidebook. Some may not have any special precautions at all. For example, if you're giving somebody Miralax, Miralax is pretty mellow. There's nothing you really have to look out for with that. It's just medication to help them poop right. So that being said, let's fill one out here just so you see what I'm talking about. Generic name for, and I'll probably spell this wrong, furosemide. Yeah, I probably spelled that wrong. Should have done a drug I knew how to spell, right? Anyway, you get the idea. Furosemide. What is the brand name for furosemide? Lasix. And of course, you have those silly underlines I put in there. What family does it belong to? It is a loop diuretic. There you go. Spelling was never my strong point. There is a type over mode in Word, so you don't have to keep, deleting the underline. Like, whoops, go back. So you don't have to keep deleting the underline, but I'm not sure how you do it. I'm going to have to look that up. Therapeutic dose, I don't remember. I'm just going to make something up right now, 10 milligram to 20 milligram, because I don't remember what the therapeutic dose was. What does the drug do? Well, it helps get rid of fluid in the body. Now, there are several reasons why a patient would take Lasix. High blood pressure, congestive heart failure. I'm just going to say my patient has congestive heart failure. Any special precautions with this drug? Well, it helps you lose fluid, so you might want to keep an eye out for hypotension. And something else that loop diuretics do is it makes you lose potassium. So you would want to keep a close eye on that person's potassium. So there's an example right there of how you would fill this card out. I have spell check. There it is. See, that's how you spell it. Anyway, there's an example of how you would fill this out. So that is that. There's one other form that we are changing on you. And then I'm going to bring that up on the screen right now. What we are going to do is for your head to toe assessment, we are going to have you on Wednesday fill out your head to toe assessment sheet like you always did before. On Thursday, you're going to do a short paragraph of your patient's head to toe assessment, because you have to also get used to just narrating it, because you won't always have that sheet, or that may not be the type of sheet that they want you to use. You need to know how to write an assessment paragraph. And here is an example of one right here. I will probably, this looks really, really busy, and that's because it's giving you all the different explanations for each of these in there. For example, lung sounds, even, uneven, labored, unlabored, right lower, right upper left lobe, right middle lobe, right lower lobe, etc. It's giving you all the possible, almost like a checkoff sheet. You won't have all of that in your paragraph. Your paragraph will probably be about half that size. And I might go ahead and just make an example to throw in there a little bit later, and I'll have that as well. But this head to toe assessment, I think I'm also going to take this and I'm going to put it in Word format so that we don't have to deal with this paint and everything. But at any rate, so on Wednesday, you will do your head to toe assessment, put that in column 1 like you normally do. On Thursday, you're going to write a little head to toe assessment paragraph so that you get used to narrating longhand. That is about it. I'm going to stop the share on this one. We might modify the pathophysiologies a little as well, but that's just going to be something simple, like we're going to have you put down your patient's primary diagnosis and what pathophysiology relates to that. But pretty much you'll be filling out the same information as you do on the regular pathophys sheet. So that's all for now. And good luck with Clinical 3. And we'll look forward to seeing you then. Take care.